The anatomical forceps are atraumatic forceps with transverse grooves. Surgical forceps are traumatic forceps with small, sharp teeth at the tips. These can be used to grasp firm tissue. The DEBAKEY forceps have special DEBAKEY toothing. Because of the toothing, the forceps are atraumatic but offer more grip than anatomical forceps. Bipolar coagulation forceps are used to seal small blood vessels. They are connected to a bipolar electrosurgical unit and conduct electricity through the insulated handles to the tips. For a more detailed elaboration of this, refer to the course The Basics of Electrosurgery. KOCHER forceps have transverse grooves and, additionally, have small teeth on the tips, similar to surgical forceps. They can be used for various purposes, for example, to clamp tissue or fixate suture threads. Here, curved KOCHER forceps are shown. These are often used to retract tissue, for example, parametrial tissue. PEAN forceps are similar to KOCHER forceps, except they lack the small teeth at the tips. These forceps are most commonly used for fixating suture threads. These are regular dissecting forceps. They come with various angles of curvature and are used for dissection and to aid in a tie-on a pass. Curved forceps are firm dissecting forceps. They can be used to dissect or perforate tissue or for a tie-on a pass. The angle may vary.